Now let me turn, if I could, to this issue of opiate addiction and thank my colleagues again in the Judiciary Committee for reporting out legislation today on a bipartisan basis. In fact, there wasn't a single no vote. It was reported out on a voice vote. Everybody in the committee agreed to it. That doesn't happen around here very often. And the reason it happened this way is that the legislation before the committee called CARA, the Comprehensive Addiction and Recovery Act, is legislation that has been thoughtfully crafted with Republicans and Democrats alike, really for the past 3 years. We've had 5 conferences here in Washington, D.C. to put together the experts from all over the country. Senator Sheldon Whitehouse and I have led this effort, but also with Senator Ayotte, Senator Klobuchar, and others. And what we have said is we want to come up with legislation that will actually make a difference in our states and around the country to deal with what is, sadly, a growing crisis of people who are abusing prescription drugs, heroin, and this addiction problem is leading to not just a lot more people becoming addicted, but people actually overdosing and dying. In Ohio, we lost over 2,400 fellow Ohioans last year to overdose deaths. It's now the #1 cause of death in America, accidental deaths in America. It's now actually more people are dying from overdoses than they are from car accidents. So this is an issue that affects every single one of us. It has no zip code. It's in our rural areas, it's in our suburban areas, and it's in the inner city. And certainly it's something that affects so many families. When I am back home talking about this, it's hard for me to find a group I'm meeting with that doesn't bring this up. And most recently, I was in Ohio this week talking with women who had been trafficked. They also were women who were given drugs and became addicted, and that dependency led to the kind of sex trafficking that they were involved with, and their sense of being coerced and being compelled because of this drug addiction issue. They're now trying to work through that issue. God bless them. They're back with their families. They're back getting their life back on track. But as they told me, Rob, going through this issue of the addiction and the treatment and the recovery is hard work because the grip of addiction from opiates, meaning prescription drugs and heroin, is very, very difficult to address. And that's why our legislation is so important, because it provides to state government, to local government, to nonprofits, the tools they need to be able to have better treatment and better recovery programs, longer-term recovery. But it also focuses on prevention and education to try to keep people out of the funnel of addiction. And it also helps our law enforcement personnel to be able to give them the ability to save lives through Narcan and naloxone, which is the drug that is really a miracle drug to be applied when someone has an overdose, is saving lives right and left in my state in Ohio and around the country. And then finally, our legislation helps to get the prescription drugs off of the bathroom shelves to ensure that these prescription drugs, which have been overprescribed over the years, and there are too many prescription drugs out there, aren't going to be taken by somebody, often young people, who gets them involved in this addiction issue. And then, of course, often they turn to heroin as a less expensive and more accessible alternative. Our legislation does that. It also provides for a monitoring program for the prescription drug prescribing, so that we know who is getting prescribed what, including across state lines, which is why it's very important to have federal legislation in this regard. Because until we get at this issue of prescription drugs, it's very hard to stop what is, again, a growing crisis in our communities. Can we turn the tide? Yes. I'm absolutely convinced that we can, because I've seen the treatment programs that work. I've seen the prevention and education programs that work. I started my own anti-drug coalition back in my hometown of Cincinnati, Ohio, about 22 years ago. And using proven techniques, we can make a difference. And we have made a difference there. Unfortunately, most communities don't have that kind of a coalition, that kind of effort. Our legislation will help to provide that. And then in treatment, most Americans who are suffering from addiction do not have access to treatment. Most. This will provide more needed resources, but not just money, but also being sure that the money is going to evidence-based treatment and recovery that works, that has been proven to work, so that we're not just throwing money at a problem, but we're actually setting up a framework for success. The legislation is supported by lots of groups because it's been carefully crafted, and it's been bipartisan, or I would say nonpartisan. Over 120 groups, Mr. President, have come in from around the country to support this legislation. Today, I'm happy to report that we have a new endorsement, and this one comes from the National Fraternal Order of Police. The FOP has actually endorsed our legislation today, which is a tremendous boost to us. Law enforcement around the country has been supportive. The doctors have been supportive, nurses, first responders, those in recovery themselves, and of course, experts from around the country who are involved in providing treatment and providing the prevention that's science-based, evidence-based, that know that if they can have more support from the federal government, they can do more. They can leverage that at the local level to be able to make a difference in our communities. Mr. President, I'm glad to hear that this legislation got reported out with such a broad bipartisan support today, and that everyone said this is good legislation and we need to move it forward, because the next step is to get it to the floor of the Senate and to get it passed here in the Senate floor, then get it over to the House where there is a companion bill. In other words, there's Democrats and Republicans working together in the House as well on this issue, understanding the urgency of addressing this crisis. They're ready to go. If we send them the legislation, I believe that legislation can end up on the president's desk in short order. And we can really begin to turn things around to change what is unfortunately a growing problem. It's a spreading problem, and begin to reverse it. And again, through prevention and education, keep people, particularly young people, from making bad choices and going down this route. I've gone across the state holding roundtables on this over the years, but in the last month alone, I have met in Columbus, Ohio, and Marion, Ohio, and in Cleveland, Ohio, with people who are directly affected. In Cleveland, I toured the Rainbow Babies Children's Hospital. This is one of the great children's hospitals in America. There they have lots of specialists, particularly specialists in an issue that is sadly one that is affecting more and more of our hospitals, and that's drug-dependent babies. These are babies who are drug addicted when they are born because their mothers used. These are, again, consequences of this addiction problem. We talked about the opiate addiction problem. They take these babies through withdrawal. Now, these are babies, many of whom are born prematurely, can almost fit in the palm of your hand. And these babies, God bless them, are getting the help they need to be able to withdraw from that addiction. We don't know, frankly, what the longer-term health consequences might be, but we do know that many of these babies are now starting their life in a much healthier situation because of this special expertise that's being provided. But these hospitals are telling me, Rob, this is an increasing problem. Every hospital in America needs to have this expertise now to deal with a situation that is hard to imagine, a baby who is born drug addicted. I also toured a community alternative sentencing center in Claremont County, Ohio, that's in southern Ohio, to look where a court is actually taking people who have been arrested for possession, and instead of throwing them in jail, is setting up an alternative program where they can get some of the treatment that they need and get some of the life skills they need to get their life back on track. And it's an intensive program that's working. These are programs that are also supported by our legislation. Our legislation also deals with people who are in prison, who have addiction problems, to be able to get them some treatment they need so when they get out of prison, they don't fall back into a life of crime to support their addiction problem. Most recently, I was in Columbus, Ohio. I met with 4 women who were recovering addicts, who again had had this addiction really foisted upon them as part of human trafficking, sex trafficking. Their traffickers got them addicted to make them dependent. And in one case, the woman told me she wasn't paid anything, she was just paid in terms of the drugs. And her trafficker kept her dependent because of that. These women, again, were in a program where they had been given the opportunity to get into treatment, given the opportunity to be able to get their life back together. But sadly, a lot of people do not have that opportunity, not having access to treatment. So our legislation will be very important to do that. The bill targets the very issues that we know have to be addressed, keeping people away from these substances in the first place. And then once they are addicted, if they become addicted, to get them the treatment they need to begin to turn their lives around, and that longer-term recovery, which we think is absolutely essential from the experience and the good science that's out there for successful programs. It's important that we have, in some cases, medication treatment as well. It supports that. It also says, again, that we've got to help our law enforcement more. And I think that's one reason why the Fraternal Order of Police and why the National Sheriff's Organizations and others have supported this legislation with such wonderful statements as I just talked about earlier that we got today from the FOP. Mr. President, this is an issue that will continue to be a serious problem in all of our communities unless we take these kinds of actions. At the federal level, the state level, the local level, we have to work as a team with nonprofits, with people who are in the trenches dealing with this. If we do not, we will continue to see families torn apart. We'll continue to see communities that are devastated, including by the crimes and other consequences of this. And we'll continue to see Americans who are not able to fulfill their God-given abilities and destinies because of this drug addiction problem. Today, I'm told that others who support this legislation would like to spend more money in addition to the $80 million that this program provides, an additional $80 million every year going forward. And again, this is a well-crafted, well-thought-out framework as how to spend that money more effectively to be able to address the problem. I am for spending more money. And if there are people who would like to spend more money on this issue of opiate addiction, I'm for that. I think it's enough of a crisis that we should be spending more funds on it. But I will say something else. Let's get this bill moving. Let's get this bill to the floor. Let's get this bill passed. Let's get the House to pass the companion legislation. Let's get it to the President's desk. This is an urgent problem. We cannot wait. And if people are going to offer other ideas, including more funding, and funding that is in an emergency rather than in a way that is paid for, that may make it more difficult to move this bill forward, because some people, of course, in this chamber will not support that. We now have a consensus on this bill. Let's not play politics with this bill and stop this bill. Let's move this bill forward. Right now, we have on the floor of the Senate an energy bill. It includes energy efficiency provisions I've worked on for years, and yet it's being stopped by other issues, important issues. But around here, we too often refuse to move forward on legislation where there's a consensus, where we know it's the right thing to do, because other issues come up, and sometimes it's other issues that, again, are very important issues, but ones that end up stopping the legislation and not allowing us to make progress for the people we represent. So I do support more funding. I support the funding in this legislation, of course, and full funding. And over and above that, I would support additional funding. The President's budget has a request for additional funding. I talked about that today in a hearing we had, and I told the Secretary of Health and Human Services I would support some of these programs that have additional funding. Let's be sure it's well spent, as it is in this legislation. Let's be sure we are not just throwing money at a problem, but that we're actually making a difference in the lives of the people we represent. And let's be sure that it doesn't derail this effort to get this legislation passed. We're on a track now. It's bipartisan. It's bicameral. It has the President's general support. He hasn't specifically said he'll endorse this bill, but his representatives, including the Secretary of Health and Human Services today, were very supportive of the direction we're moving. It was reported out of a committee today in a totally bipartisan way. It was unanimous. Again, that doesn't happen often around here. Let's address this issue now. Let's not sit back and play politics. Let's take the politics out of this, as has been the case for the last few years. Sheldon Whitehouse has been my partner in this. Sheldon Whitehouse and I don't agree on a lot of issues. He's more liberal, I'm more conservative on some issues. We agree on this issue because we know the way it affects the communities we represent, the families we represent, and the people we represent. Let's move forward on this legislation, Mr. President. Let's get it to the floor, let's get a vote, and let's start turning the tide, changing the dynamic on the ground, where instead of us having this creeping problem of addiction and all of its horrible consequences, that we begin to allow people to get their lives back together, to give them the opportunity to get their families back together, to be able to achieve the dreams that they have for themselves and their families. Thank you, Mr. President.